I often get asked questions about scar revision, or sort of procedures that can be done to make the appearance of a scar better. Patients will come asking if the scars can be revised to improve their appearance, or even if scars can be removed completely. The answer is that scars cannot usually be removed completely. As much as I'd like to be able to say that plastic surgeons can do that, for the most part we really can't. What we can do though is to revise the scars, make them thinner in appearance, sometimes reorient them or place them in a position that's less conspicuous. So that all falls under the general topic or category of scar revision. I'd say that for most patients with scar revision, the common requests really come down to areas where they've had a scar from either a prior operation, where things may not have healed as well as they'd like. Let's say either the area where it was closed is under a lot of tension, and so the scar has just widened. Or if staples or sutures were used and were left in a little bit longer than could have been, they may have healed with some marks. Or in cases where there was even a past infection, again from surgery or from, let's say, an injury, like a laceration from an accident. All those are circumstances where scars may heal in a sort of less than ideal manner that can be made better with a scar revision. Most patients that come to me for scar revision, they vary widely in age, but in most cases there's a specific area where the scar is really widened or really just doesn't have an ideal appearance. It really can vary from the trunk, abdomen, breast sometimes. There's scars sometimes people have on their arms, legs. Really varies widely. I would say that best candidates for it are patients who have at least waited a year after the previous scar has completely matured. Now what happens is that when, let's say, a previous injury has been repaired and healed, or previous surgery has been done, scars really take about a full year to mature. And what that means is that initially they sort of can thicken, they can be a little bit dark, but over time they can really fade quite a bit. And it really takes the body about a full year to really do this to its maximum potential. I typically like to wait this full year because my personal opinion is I think the body can naturally do in that first year better things than what we can accomplish surgically. And it's really therefore worth it to wait that full year to see what the body can accomplish on its own. If at the end of that first year it really hasn't healed quite as nice as we like, well then at that point we can try surgery and see if that will make things better. Let's talk about the procedure. It's usually about an hour long or so. This can vary quite a bit depending on sort of the length of the scar, sort of where it's located. This can almost always be done under local anesthesia. My method of doing scar revision is not just to excise the scar and then to close it, but after excision I typically will sort of raise the skin and fat on both sides, move things toward the center, and then close it under minimal tension. It's my belief that basically by having less tension during which the scar is healing, there is less chance for that scar to really be pulled apart or widened during its healing process. So I typically will like to advance these, the skin and the fat on both sides to really minimize that tension. I think that that leads to very nice results, and I've had good success with that. After the procedure, I will usually put quite a bit of dressings on the area. Depending on the patient and on the nature of the scar, I will sometimes tape it with a variety of surgical tapes. I do tend to see my patients after scar revision pretty frequently, usually about a week, 2 weeks, and then usually at 1, 2, and 3 month periods. And this is good because it allows me to kind of tailor what I tell the patient to do post-operatively to really give them the best result in the end. I think that sort of combining, careful surgical technique, careful evaluation, timing, as well as good post-operative care, you can get really nice results. In some cases, a scar can really be thinned quite a bit, and patients are usually quite happy.